Good day everyone, I'm Angelo Agapay. Today, I will be assessing the abdomen. Before assessing the patient's abdomen, consider the patient's history. If he experienced abdominal pain, examine the painful area last. If he has a full bladder, have them void to encourage relaxation. Next, inspecting using the sense of sight. Observe the patient's face regularly for signs of pain or guarding. Start by inspecting the abdomen from the ribs to the symphysis pubis. Its contour should be symmetrical. Okay, next, to highlight any bulges, shine a light across the abdomen towards me. Start with the far side of the abdomen. Use 10 light. Next, assess the umbilicus. It should be midline and inverted. Auscultate the abdomen. We will use stethoscope to auscultate the 4 quadrants of the patient. First, the lower left quadrant. Next,
upper left quadrant.
next will be the upper left quadrant. Next, the upper right quadrant. And lastly, the lower right quadrant. Auscultate for vascular sound. Using the bell, listen over the aorta, renal arteries, iliac arteries, and the femoral arteries. Okay, next, listen for bruits, which may be heard during systolic. Okay. Next, percuss in a systematic fashion. You should hear dullness over the Galen organs and tympani over the air-filled organs. Okay. Next, percuss each organ, beginning with the liver. Percuss right long area down to the mid-clavicular line until there's dullness. Upper border of liver is usually located at the 5th ICS. Next, percuss up mid-clavicular line of my patient. So now, I will be measuring the size of the liver. And it should be 6 to 12 centimeter of the size. Next, assess the stomach. Percussing over the left upper quadrant. Okay, have the patient to roll on his right side. Assess his spleen by percussing from 6 ribs down mid-axillary line. Expect to hear dullness between 9 and 11 ICS.
Grabe.
Sir, can you take a deep breath? Next, percuss the bladder. If the patient has urinary problem, start at the point 5 cm above the symphysis, pubis, and continue to percuss downward. The bladder should not be palpable. Next, light palpation for abdomen. Palpate the right lower quadrant and move clockwise to all 4 quadrants. Next, switch to deep palpation. Push from 5 to 8 cm. Next, palpation of the liver. Slide left hand under the patient's along 11 or 12 ribs and push up. Place your right hand on the right upper quadrant and push your fingers down and under the right costal margin. Next, palpation of gallbladder. Using the regular techniques used for the liver, normally gallbladder is not palpable. Next, palpation of gallbladder. Using the regular techniques used for the liver. Normally, the gallbladder is not palpable. Next, palpation of spleen. Reach over the patient and place your left hand behind his back and attempt 12 ribs are pushed up. Next, palpation of spleen. Reach over the patient and place your left hand behind his back and attempt 12 ribs are pushed up. As you push the right hand in and up towards the axilla, have the patient take a deep breath. Normally, spleen is not palpable. Next, assessing the bladder. If bladder problem is suspected, place both hands in the midline 2.5 cm above the symphysis pubis. Palpate in an upward direction until you feel the edge of the bladder. Normal bladder may not be palpable. Next, palpation of right kidney. Using left hand under the patient's waist below the 12 ribs and right hand directly above it. Next, palpation of aortic pulsations. By placing thumbs and index finger left to the midline. Estimate the pulsations with 2.5 to 4 cm. Next, testing of abdominal superficial reflex. Stroke the handle of the reflex hammer across his abdomen to the side and to the midline. Normally, muscles on the stroke side contracts and the umbilicus deviate towards the stroke area. Stroke, dahil stroke area. Stroke na. Sige na, sakto na to. So now, I will be assessing the lower extremities or leg assessment. So first, note the leg range of motion, muscle mass, and strength. So to assess the vascular system, inspect the patient's leg. So to assess the vascular system, inspect the patient's legs, observe the skin color and condition, hair distribution, and nail integrity. Look for abnormalities such as asymmetry, lesions, and edema. With the dorsal hand, check the leg's temperature from the feet up. It should be warm and symmetrical. Now flex the patient's knee. Compress the calf muscle against the tibia. Release the pressure and dorsal reflex the patient's feet. It should not cause pain. Next, palpate the peripheral pulsation. To palpate the femoral pulse, find the artery halfway between the symphysis pubis and anterior superior iliac spine. Compress it and release slowly. Then, pull should gently tap your fingertips. Next, to locate the palpable pulse, bend the patient's knee. Feel for the patient's pulse in the palpable fossa. Palpate the posterior tibialis pulse between the malleus and Achilles tendon. Assess the dorsalis tibialis pulse by palpating lightly lateral to the extensor tendon of the great toe. For edema, tracing over the tibia or medial malleolus for 5 seconds and then release the pressure. Normally, finger pressure should not leave it. If it does, great for edema. +1 for mild heating, +2 for moderate heating, +3 for deep heating, for severe heating. Continue assessing the legs by evaluating their sensory function. First, light touch. Second, pain sensation. Third, vibration sensation. Fourth, sensation. Lastly, pain sensation. Next, assess the motion function. Assess the deep tendon reflexes. Patient set up with his legs relaxed. Place one hand above the knees, then tap his patella tendon with a reflex hammer. The lower leg should extend and quadriceps should contract. Next, test the Achilles reflex. Bend his knee, rotate his hip outward, and dorsiflex his foot slightly and tap the Achilles tendon with the reflex hammer. The normal response is plantar flexion. The next test is the Babinski reflex. Stroke the lateral aspect of the sole of the foot from heel upward. The normal response is plantar flexion with no toe padding. If any reflexes are hyperactive, check for clonus. Lightly support the lower leg in one hand and dorsiflex the foot with the other hand. There should be no extra movements and contractions of the legs, of the other leg. Next, assess the cerebral functions. For the heel shin test, ask the patient to place one heel the opposite knee and slide it down to the ankle. So sir, can you please put your heel and slide down to your ankle? Okay, the other one. Sorry. To assess the patient's gait and gross motor function, instruct the patient to walk 10 to 15 feet and then turn back. So, sir, can you please walk 10 to 15 feet and then turn back? Thank you, sir. Movements should be smooth and coordinated. His arms should swing freely and can turn back without losing his balance. Next, perform the Romberg test. Have the patient to stand on arms on his side and eyes closed. Okay. Observe for 20 seconds. He may sway slightly but should not lose his balance. This test assesses the acoustic nerve position, sense, cerebellar functions, and muscle strength. To assess tendon walking, have the patient to walk heel to toe in a straight line. He should walk in straight line without losing the balance. So that's the end of the assessment of the lower extremities.